Hello and welcome to this mini topic series. This is Kim Burns, and the topic today will be prescription drug labeling for the patient. The purpose of the mini topics, of course, is to supplement the textbook readings, lecture slides, discussions we have on them, or any other assigned materials. Just kind of focuses on the key points, quick information, the who, what, when, where, and why, and hows. And this brief presentation obviously does not represent all the information that you are expected to know for this topic. So prescription drug labeling, which we've already talked about, or you should have already read, or we should have covered before getting to this point, is FDA regulated. And what I'm showing you here is what's required of a manufacturer. So the manufacturer with that label, so the example I have here is Coumadin, that is an FDA approved label, okay? When they go through the drug approval process and they go through getting everything approved for the drug and before they can put it on the market, this is one of the elements, the label has to be approved and has to have certain pieces of information on it. Then you have the labeling, which is not only the label, but the additional information that comes with it. And the main piece that we're pretty much familiar with in practice of pharmacy is the package insert. Okay, so the labeling. Those are both FDA approved. They are also directed towards the healthcare professional, not the patient. So the healthcare professional can open up that package insert, whether it be the prescriber, whether it be the pharmacist, and they can understand what this is about. It's not for your typical layman. Now, it doesn't mean you can't give it out. It doesn't mean that people don't get access to it, but it would probably be a little bit hard to understand for your typical layman, someone without the knowledge and the experience and expertise, either in healthcare, pharmacy, or prescribing, to understand what's going on in there. So with all that being said, that's the manufacturer requirement, and we have a rule there too. There are exceptions where the FDA does require, as part of the labeling, for information to be given to the patient. Okay, so this is what we call patient information, okay, written patient information, because it's going to be in writing. And the two ones that are required by the FDA at different levels is what we call patient package inserts, or PPIs. Do not confuse that with PIs, which is the package insert. Those again are geared to the patient. The other one is med guides. Medication guides is the full name. Those are also geared towards the patient. They're very similar, but oftentimes it's confusing to understand why they're different. But if you go and if you read the book and you listen to the history of how we got to where we are, that kind of might be better for one to understand exactly why we're in this position where we are now, that there's multiple pieces of information for the patient. So PPIs and med guides are examples when the FDA requires manufacturers, okay, this to be part of their labeling. And then this actually is geared towards the patient, not the healthcare provider. And our role in pharmacy, obviously, amongst other things, is to provide this to the patient when we are dispensing them medications that require them. So PPIs versus med guides. Again, they're similar, but there's some differences in how we got to them in terms of practice is also a little bit different. So for PPIs, there are FDA regulations that were passed at one point specifically for certain products and classes. There are still a couple of those rules out there. One of them is there's an FDA rule for oral contraceptives and another for estrogen-containing products. There used to be one for progesterone products as well too, but that was repealed. So oral contraceptives and estrogen-containing products currently have FDA rules which require patient information to be given by the pharmacist when dispensing to the patient. These are called PPIs, patient package inserts. So they are FDA approved, okay? Pharmacists have to give them for new and refill prescriptions in the community setting. When they're in the institutional setting, that's modified with the original prescription and then every 30 days thereafter. And what happens is, because this is a pharmacist requirement, if we don't meet that requirement, it's actually a misbranding violation, because that is part of the labeling. FDA requires it. It is our obligation to give it. Again, this is written information for the layman. It gives information about the uses of the medication, risks, and precautions. Now, when you give this to the patient, if you're counseling them, this is a good supplement for you as well too. This does not substitute for counseling, but obviously it can supplement the counseling. So when the FDA had these rules for these products decades ago, they then decided that they are going to do this for all drugs. However, because of politics, basically that didn't happen. So the private sector kind of stuck their 2 cents in, if you will, and said, well, wait a minute, we don't agree with this, right? And there's a variety of reasons why, and the book talks about that. But at the end of the day, basically, I believe this was under President Reagan, it was decided that, okay, the FDA is not going to do this, and the private sector, okay, can basically come in and work on written patient information for patients on these drugs. So overall, this written information is seen as an important thing for patients to help them understand, right? Like I said, to supplement counseling. So it's looked at by the FDA as important to be given for all drugs. But because the private sector is like, no, we don't want the FDA to regulate all of this, right? Let's step in. So the PPI rule that they passed for all drugs was actually revoked. However, the ones that were already in place for the oral contraceptives, for example, stayed there. So that's why we still have a couple FDA rules that still apply to certain products. Those were never repealed or revoked. So that's PPIs. So again, you will see them in practice, and you have to give them out in community, and there's a revised or modified version of handing them out for institutional settings. Turning to med guides. So with the private sector taking on the responsibility, if you will, coming up with written drug information for patients, the FDA really wasn't satisfied with these efforts, and so they passed a med guide rule, medication guide, med guide rule, prior to 2000. I think it was in late 90s. And what happened was the FDA said, well, we can require medication guides for products that have serious and significant concerns to the public. So now they're saying, okay, fine, we have these couple PPIs and these rules in place. The private sector is doing something. However, we want to step in and we want to require medication guides for products that meet a certain standard. So this rule was not specifically for a certain class or drug. It's basically like whatever the FDA adds to this list. So there is a list, and it started, and eventually it started small and slow, and now it's up to many products and classes. So you can go to the FDA database, just Google FDA medication guides. You can find a database, you can search for them, you can click on them and read them and view them. You can see what products and classes are covered by the program, and it's basically thousands, because there's certain drug categories, certain drug classes, like for example SSRIs, long-acting opioids, certain products by themselves. So there's definitely a lot out there, and they've continued to add on, not take away. Same thing like the PPIs, we are required to give these to the patient. Now, the FDA approves the wording, if you will, the format, everything that's in there. The manufacturer then gives it to the pharmacy or has it available for the pharmacy to get. And then the pharmacy, through the pharmacist, or that is handing the prescription to the patient, is to make sure that that patient gets that. So same thing for community, new and refill, and then for the institution, it's modified. The book goes into a little bit more. If a patient requests it, for example, or if the doctor requests it for the patient. But in general, there's not a set standard in terms of how many days, like we saw with the estrogen products, but basically if it's needed or wanted by the patient or the doctor or at their request. Same thing though, if we don't give out something that the FDA requires us to, it's part of the labeling, it's a misbranded product. So now if patients are receiving products that do not require a medication guide, right, the whole med guide program, in addition to having a set number or list of products, not all, they also said that the patient was still to get what's called useful written patient information. So this was termed CMI, Consumer Medication Information. So the private sector, so what I mean by the private sector is basically, the chains, the community pharmacy, APHA, any of the organizations that are involved in that stuff, they gave some input, and there are companies out there like First Data Bank that have CMI available. So now companies like Rite Aid or CVS can quote, if you will, buy this database and have it available. So it's not Rite Aid doing it themselves, right? There's obviously someone building up this drug information and making this written information for the patient. But the FDA said it had to be useful. So what that means is when someone reads it, they have to be able to use the information. And then the goal obviously is that also every patient would get it for every drug. So you have your PPIs that are required, you have your med guides that are required. Then there's the CMI, which is the private sector, and the FDA basically set goals. So per the FDA, written patient information is important, and it should supplement patient counseling. So again, it's not a substitute. CMI, though, is not a substitute for PPIs or med guides, okay? They're different things. They're not regulated by the FDA. They're not approved by the FDA in advance. Now, the med guides are often an important part of a REMS program, risk evaluation and mitigation strategy. So it could just be for a product by itself that's needed, but it could also be part of a REMS program as well. And if you want to see more about the REMS program, that's also on the FDA website. These are just examples of patient package insert and med guide examples. I know it's kind of hard to see in the left, but that is a faded, if you will. This is a Premarin product, which is an estrogen product. So this is the FDA approved patient labeling. So they've approved this for the manufacturer to be given to patients, and then it is the pharmacy's responsibility to make sure that they get it. Now, for sometimes it's within a package. Other times you might have to rip it off. Some companies now print this up after their label and stuff like that. So whatever way you have it, you still need to get it to the patient. To the right is an example of a medication guide, and this again is not the whole thing. You could scroll down. So for example, the Coumadin one is a few pages long. But anyways, it just shows you an example of what it looked like, but you can easily see these on the internet under the FDA. Google it, or if you work in a community or practice setting, you can look at these as well too, because they're either going to be attached to the package, part of the packaging, or they're going to print up whenever the label is. So back to the CMI, like I said, this was up to the private sector to develop. The FDA wanted all patients to get it, and they wanted it to be useful. But they're not reviewed and regulated by the FDA because the FDA didn't have the authority to do that. That's why, because of the politics, that's how it happened. So basically, the FDA set useful information standards and distribution goals for this private sector. Then they said if it wasn't met, they would then create a federal comprehensive patient information program, meaning now they're going to say again that they're going to come up with one, probably like they had recommended before. So there was some backlash for that. Again, the private sector is like, hey, look, you're threatening us, like, we're trying to do this, everything. So Congress went in and basically changed to goals without threats. So let's make these goals, and we will basically have private sector try and reach these goals. And they set these goals. And the goals included that 95% of patients were to receive useful written information, okay, or the CMI, and these are for new prescriptions, and they wanted that by 2006 to be met. FDA accepted this private plan. The private sector came up with how they would do that. So again, they wanted 95% of patients getting it, and they also wanted it to be useful written information. So it's something that the patient can read and understand and mean something to them. So they looked at these plans, if you will. They assessed the goals in 2001. They did find that most patients were receiving written information, but it wasn't the 95%. And they also found that a lot of the CMI out there was not useful, meaning patients, when they were surveyed and everything, it didn't really mean anything to them. It wasn't helping them for the purpose of what it was put there for. So with that, the FDA provided guidance for the industry to say, okay, let us help you understand what makes information useful. Write in a certain grade level, write in a certain format, fonts, things like that. Let's help you. So the FDA did put some guidance out, but again, this is not regulated by the FDA. So, but it was their attempt to try and help the industry in the private sector role of them trying to get this written patient information out to patients. So there was a follow-up study in 2008. Yes, I know it said 2006, but many agencies are late. So they did this follow-up study, and it did show improvement from the initial assessment back in 2001, but the goals were still not met. So unfortunately, the FDA then stated, okay, currently the voluntary system of this written patient information has failed. So they then have since set a goal for a single easy to read document, meaning patient medication information, or PMI is what they term it. So that was their goal now, to say, okay, let's revamp all this, right? Instead of having this and this and all these different things out there, let's come up with PMI. So they were working on it. I read some things for years. However, I've not seen anything about it for a while. So whether they were doing studies on it, whether something else is going on, but I have not seen this implemented into practice yet. So it's not there at that full level. So you might hear about it or see some things, but it's not completely done to where this is what's being done. So where are we now? We are still at the PPIs are required. We have med guides that are required, and then obviously we have this CMI as well too, which the industry has developed and pharmacies can give. But since the CMI is not regulated by the FDA, right, you cannot use it as a substitute for a PPI or a med guide because that is part of the drug labeling. FDA has to approve that, works with the manufacturer on that, pharmacist has to give it. So yes, what that means is when a patient comes in, and if let's say they're getting Coumadin, okay, we know there's a medication guide for Coumadin. That patient has to get that medication guide. They're also going to get CMI because the pharmacy is also going to print up the CMI for it. So they're going to leave with a medication guide and with CMI. It's a lot of pages. So that's how it works. But as a pharmacy, you can't have the CMI print up and say, oh, I met my obligation, because the CMI is not the same thing as a med guide. It may look the same, it may have the same information, it might be very similar, but it's not the same. So in summary, we have patient package inserts, or PPIs, we have medication guides, and we have consumer medication information. Patient package inserts and medication guides are FDA regulated. They're approved by the FDA. The manufacturer is part of their labeling. They're provided to the pharmacist. The pharmacist has to give out at certain types of prescriptions. Patient package inserts are limited products, really. It's just the oral contraceptives and the estrogens. Even those are classes, they are limited products. Where the medication guide, on the other hand, is a list of products and classes. And the FDA, because it's a rule that doesn't cover certain drugs or certain classes, it basically can continue to add to this list. And now there's a database for it. Both of them, PPIs and med guides, if your requirements aren't met to give out the required labeling geared towards the patient, that's a misbranding violation, okay? So it's a Food, Drug, Cosmetic Act violation. Comparatively, CMI is developed by the private sector, not reviewed or approved by the FDA, although the FDA has tried to give some guidance and some help in developing it to make it better. It's not reviewed or approved by the FDA, so it's not part of the drug labeling. It's also available pretty much for all products out there. So again, you will see that for all products, but then you'll also see PPIs or med guides for other products and classes as well. So if you need more help, there is additional information about these on the FDA website. Obviously, the textbook covers this. We'll talk a little bit about lecture.